So how do you handle bipolar affective disorder? So once you have been diagnosed with bipolar affective disorder, the mainstay of treatment is of course your compliance to medications. Then you of course have to build an insight into the various signs and symptoms of the illness, the various warning signs that you have to notice at the onset of the illness, as well as the triggers that can lead to the illness. This can help you prevent a relapse and seek professional help as early as possible. One more point to note here is you can also try to educate your family members about the illness, where they will be helpful to you in trying to recognize the illness and then encourage you to seek professional help at the right time. Is bipolar affective disorder progressive? Yes, bipolar affective disorder can get progressive if the disorder is not addressed early. So you delay the diagnosis of bipolar affective disorder or manage the disorder very late, then the intensity and the severity and the frequency of the symptoms can get even more severe, and to a state where we diagnose that as a rapid cycling type of bipolar disorder, where there can be about up to 4 episodes of this in a year. And this occurs because of a process called as rekindling, where the number of previous episodes can increase the frequency and intensity of the subsequent episodes. So how do we treat bipolar affective disorder? Of course, the mainstay of treatment in bipolar affective disorder is medications. Medications, of course, we decide whether hospitalizations is required or not based on the severity of symptoms. After acute treatment at the hospital, we decide whether the rehabilitation program is required or not. That again depends on the severity of symptoms. At some stage of the illness, if there is poor response to medications, other treatment modalities like ECT may be required. Post-hospitalized care at the rehab, there is insight-based treatment that may be required, that we term as psychoeducation, where the patient is explained about the symptoms that occur in the illness, the warning signs of the symptoms, and how he has to handle the illness later. There are other forms of psychotherapy that's also carried out, that is called as Psychosocial Interventions, and it consists of maybe the cognitive behavior therapy, IPSRT, interpersonal social rhythm therapy, and of course the family focused therapy is also important here. The family is also involved and explained about the symptoms of the disorder. So at Cadabams, we definitely offer both occupational therapy and supported employment. Occupational therapy is carried out by occupational therapists who help the individual regain some amount of independence in terms of all aspects of life, and of course help them out with some form of supported employment. So how can a family take care of a patient who is diagnosed with bipolar affective disorder? The most important aspect to note here is the family member developing an insight about the symptoms of the illness and the warning signs at the onset of the illness. This is important in order to identify the onset of the illness and encourage the patient to seek professional help as early as possible. The second point to note here is the family being aware the need to be compliant to medications. So they should ensure that the patient continues to take these medications advised until advised by the medical professional. The third point to note here is that the family member should first address the caretaker burden that he may be going through before he takes care of the patient, and he may require some professional help if required. This is done in order to give enough supportive care to the patient during the onset of the illness, both manic episode and the depressive episode.